What if the ending were different? If what happened before wasn't what happened every time? Or if the past was really no predictor of the future? What kind of world would we have? More to the point, what kind of healthcare would we have?
It's been said the 7 most dangerous words in the English language are,
but we've always done it that way.
For as long as there's been medical care, the school of thought was to wait until an illness presented itself and then to use every available idea at the time to try and treat it. We've trained generation after generation of doctors to follow this accepted norm for health intervention. But a few of those doctors didn't necessarily follow that convention. To them, the accepted ways of treatment left more questions than answers.
The school of thought with them, the driving force that propelled them, was why. Why do we have to send people home to die? Why didn't we catch something earlier than we did? Why did we choose one path of treatment over another? At MUSC, we've dedicated our organization to those who simply refuse to take the answers at face value. We've endeavored to assemble a gifted team of doctors, researchers, nurses, professors and technicians who don't believe the way it has always been done is the way it should be done. They believe in changing the possibilities.
The left ventricular assist device, or LVAD, saves people's lives. It is a small device that functions as a pump. It is implanted in the chest in patients with end-stage heart failure to tide them over to get a donor heart for a transplant, and also as part of the final stage of therapy of these patients. Once the pump is implanted, they can actually go home with the pump in place and live normal lives. And that's changing what's possible.
Basically, there are 2 ways of looking at the world. You either accept the way things are and work within that, or you refuse to be limited. You see the possibilities, the wrongs that can be righted, the broken things that can be repaired, the good that can be made great. That philosophy is at the core of what we do. It's what brings us to work each day and keeps us here long after the sun goes down. Because when you're not only changing lives, but changing the way medicine is practiced, you're changing a lot.
I'm very proud of our latest piece of equipment, the Flash CT scanner. With that machine, we can image our patients' hearts non-invasively. We can do it more accurately and faster, and with a fraction of the radiation exposure that was needed in the past. That's changing what's possible.
The College of Dental Medicine is an integral part of the Medical University of South Carolina. We've long been recognized as one of the finest clinical dental schools in the country, and now that we have a brand new James B. Edwards clinical facility has enabled us to provide technologies that enhances our students and their capabilities when they get out into practice.
The whole reason people go into healthcare is to make a difference in people's lives. It is the fundamental reason we are here.
But the way each of us makes a difference ranges from curing and healing in the present to creating a future of greater possibilities. A future filled with new, more efficient and effective treatments for diseases that have ravaged lives for centuries, or the elimination of some diseases altogether.
Neuroscience research at MUSC has made great strides in helping ameliorate neuropsychiatric diseases. We've brought together researchers from all over the country. Through this research, our new abilities to begin to eliminate these diseases here at MUSC, that's changing what's possible.
When you change the possibilities, imagine what can happen. Imagine the mark that can be left, the contributions that can be made, the words that can be spoken, words that before could have been silenced. In recent years, we've discovered just how many other doctors and researchers share our philosophy. They're coming from the most prestigious universities and medical centers in the world to join us in making their own difference, because they too believe in changing the possibilities, and that's what they're doing every day.
The Hollings Cancer Center has achieved NCI designation in 2009. This is based on our ability to move novel therapies from the bench to the bedside.
We're able to change the lives of all of the residents of South Carolina who are facing a cancer diagnosis by offering access to clinical trials that are only available to NCI-designated cancer centers. We're very thrilled to be able to offer these trials because they offer hope to many patients for whom standard therapies may not work. Change is possible, and change is happening now through our NCI designation.
No one can say what the exact future of medicine will be. Just a decade ago, the treatments we routinely do today would have sounded like something out of a science fiction film. The outcomes we're able to create for many patients are better than anyone could have imagined. We can attribute those successes to important breakthroughs from a new generation of committed researchers, to changes we've made internally. But the simple reality is there's a single reason that lies at the foundation of all our work at MUSC: that someone wanted to change the possibilities.
I'm Dr. Delan Eligala.
I'm Dr. Deborah Dees.
I'm EMT Brian Libby.
Dr. Jeff Wong.
I'm Child Life Specialist Jen Redford.
I'm Dr. Tom Keene.
I'm Social Worker Anna Roberts.
Dr. Peter Cotton.
Dr. Gail Stewart.
I'm Associate Professor Paul Jacques.
I'm Dr. Kathy Hermayer.
I'm Associate Dean Karen Wager.
I'm Frederica Wright with Environmental Services.
I'm Dr. Patrick Cawley.
I'm Dr. Ray Greenberg, and we all came to MUSC to change what's possible in healthcare.